Okay, so did you know that 80% of an adult's head size has been achieved before the age of 5? And most of head growth occurs in the first 2 years of life. So some important things which you need to take into account is that the posterior fontanelle is closed by 8 weeks, and the anterior fontanelle is closed between 12 to 18 months, which is important. Later on, we will discuss about this. Okay, so we want to know what some of the causes for microcephaly are. So microcephaly means a micro, i.e. small head. So more specifically, it means a head which is less than the second centile in circumference. So some causes, well, the most common cause for microcephaly is your parents also having a small head, i.e. this is familial cause. And often you can recognize this when this change has been present from birth. Often children who have familial microcephaly also have normal development. Also, a cause of microcephaly could be due to a developmental delay. Okay. And then you can get congenital infections. This is meant to be something infected. And you can get acquired insults to the brain, such as hypoxic injury during birth, so oxygen's not getting there, or hyperglycemia, or glycemia, or meningitis. Now let's go on to discuss our causes of macrocephaly, i.e. large head. Again, so a large head is actually a head which is above the 98th centile, and a simple cause for a large head microcephaly could be that naturally there's a tall stature going on, and so the head will be large as well. You can have familial causes, so your parents could also have large heads, so you may want to calculate the mid-parental head percentile just to see whether the child's head is normal for that particular family. And then you have to actually watch out also for danger zones, okay? So if you have a head which is rapidly increasing in circumference, you need to be able to rule out raised intracranial pressure, or hydrocephalus, or chronic subdural hematoma, or cerebral tumor. So as I mentioned before, if the child's fontanelles are still open, then by all means do an ultrasound in order to check for intracranial pathology. However, if they're not still open, then you can just do a CT or MRI to rule out more dangerous causes.